Life-threatening allergic reaction, or anaphylaxis, is a serious health and safety issue with a potential impact on the American workplace. Whether it's caused by a food allergen, insect sting, or an accidental latex exposure, anaphylaxis can be a life-threatening event that requires immediate emergency medical attention. Hello, I'm Barry Eisenberg, Executive Director of the American College of Occupational and Environmental Medicine, and welcome to our program. Over the next half hour, we're going to take a close look at anaphylaxis in the workplace, including what employers can do to raise overall awareness, help at-risk employees avoid accidental allergen exposure, and incorporate anaphylaxis response into existing company safety plans. I'll be joined by three experts that will share their unique perspectives and provide some important information that you can apply in your organization today. For today's program, please email us any questions you have along the way, and we will get back to you with answers from our guests or from the ACOEM team. Our first segment is on creating greater allergy and anaphylaxis awareness among employees and management. Joining me is ACOEM President-elect Ron Loeppke. He also serves as Vice Chairman of U.S. Preventive Medicine. Ron has a vast amount of experience in developing programs for employees designed to create a better understanding of anaphylaxis, and I can't think of a better source of information on the topic of raising overall awareness. Ron, thanks for joining us here at ACOEM today. Welcome.
It's great to be here, Barry.
Ron, let's get right to the basics. What is anaphylaxis?
Anaphylaxis is a severe life-threatening allergic reaction to a chemical that has become an allergen to a person. For instance, after being exposed to a substance such as bee sting venom, a person's immune system becomes sensitized to it. And then on later exposure to that allergen, an allergic reaction may occur. The reaction happens quickly, it's severe, and it involves the whole body.
Ron, you mentioned bee stings. What are some of the other common triggers?
Well, anaphylaxis can occur in response to any allergen. Sometimes there's no known cause, but some common allergens include food allergies, such as nuts and shellfish, drug allergies like penicillin and sulfa drugs, and insect bites and stings. On occasion, pollens and other inhaled allergens can cause anaphylaxis.
If someone were exposed, how quickly would the symptoms develop and how would they manifest themselves?
Well, the symptoms develop rapidly and may include the following. From respiratory symptoms like coughing, wheezing, tightness of chest, shortness of breath, swelling or tightness of the throat, hoarse voice, nasal congestion, trouble swallowing. Cardiovascular symptoms like weak pulse, dizzy, lightheaded, palpitations, loss of consciousness or shock, and even skin symptoms like a rash, hives, itching, red and warm skin changes. Gastrointestinal symptoms like nausea and vomiting, cramping, diarrhea, pain, and then other symptoms like even swelling of the tongue.
Given that set of symptoms, I'm assuming then that anaphylactic reaction should be considered as an emergency medical situation?
Anaphylaxis is an emergency condition and it requires immediate professional medical attention. Administer epinephrine intramuscularly and then call 911 immediately. Epinephrine autoinjectors are considered to be the first line of treatment in the case of anaphylactic reaction.
Why should employers be concerned about this?
The sheer volume of people at risk for anaphylaxis, which in America, as many as 40 million Americans have the risk of anaphylaxis, means that there are people coming into the workplace every day carrying this risk.
So Ron, it sounds like this is all becoming more common in the workplace. That being the case, do you have any general tips for employers?
Well, certainly anaphylaxis is no stranger to the workplace. And occupational health and safety departments, individuals at risk, and employers need guidance on managing the risk of anaphylaxis in the workplace. While they also need to be sensitive, though, for privacy. So adults at risk of anaphylaxis need to manage and take responsibility for their own health conditions, including informing their employers of their risks. However, workplaces also need to be accountable and prepare for and be aware of risks and how to respond.
Are there things that employees can do to reduce their own risk in the workplace?
Well, with the growing number of individuals experiencing allergies, it's imperative for workplaces to incorporate anaphylactic reaction preparedness in their emergency protocols.
Ron, given some of those trends, do you have some general tips or advice that would be helpful to employers?
Yes. Employers need to incorporate an anaphylaxis response plan in the company's emergency procedures and then train emergency response personnel in first aid. They also need to provide some general information about severe allergies in work memos, newsletters, and other communications for employees and their family members. And also placing a response plan for anaphylaxis on the staff bulletin board is a good idea.
Ron, thinking about this from the employee perspective, are there some things that they can do to reduce their own risk?
Yes, first and foremost, they ought to tell their managers and their colleagues about their allergies, and also where to find their epinephrine autoinjectors. Also, they're advised to teach colleagues how to recognize the symptoms of anaphylaxis and how to use the autoinjector properly. They should also work with colleagues to find ways to minimize the risk of accidental exposure to those triggers, like food allergies.
So if you're an employee and you know you're at risk, what kinds of things should you be encouraged to do?
Well, provide managers with an anaphylaxis emergency response plan that can be kept in the personnel file. And secondly, employees at risk should also keep a copy of that plan with them, either in their auto-injector carrier, their purse, or their wallet.
Ron, thanks again for being here with us today. I think we all agree that this is an important workplace health and safety issue that requires close and careful attention. Coming up, we'll be joined by Dr. Ed Bernacki from Johns Hopkins University. Ed will talk about their approach to reducing the risk of anaphylaxis and share how Hopkins has made real progress. So stay with us. We'll be back in a moment. Welcome back to our program. Joining me now is Dr. Ed Bernacki, Executive Director of Health, Safety, and Environment at Johns Hopkins University. In this segment, we're going to take a look at how Hopkins is continuously working to avoid accidental allergen exposures at their facilities. Johns Hopkins has a unique challenge in managing not only hospital settings, but also labs and classrooms. Even their grounds crews have unique risks. Welcome to the program, Dr. Bernacki, and nice to see you here back at ACOEM. Welcome.
Nice to be here.
Before we get into the specifics, could you just tell us a little bit about your roles at Hopkins?
Well, I'm a professor of medicine at Johns Hopkins, and I'm director of the Division of Occupational Medicine in the School of Medicine. That's my academic role. But I also am the chairman of the safety, it's called the Joint Committee on Health, Safety, and Environment for both the Johns Hopkins Hospital and University. And we have roughly 60,000 employees that we're responsible for in Maryland.
Speaking about those 60,000 employees and their health, how important is anaphylaxis preparedness?
Well, significantly important. I think we recognize it from the clinical setting prior to sensitization in the area of latex and patient safety. But in our environment, we have to worry about the grounds crew. We have to worry about the individuals who are sensitized amongst our employees to antigens that can cause anaphylaxis. And we have to worry about our patients. So our cornerstone is preventative programs. 12 years ago, we initiated a latex-free policy, and that's worked out very well. We rarely have a case of occupational asthma secondary to latex in our environment. We created policies to reduce the risk in the laboratory. We ban the eating in laboratories and other areas, desks, offices at Hopkins. And this has significantly reduced the risk down. And on the treatment side, all employees, when they come into Hopkins, in essence, fill out a questionnaire. Are they allergic, and have they had an anaphylactic reaction? And if they have, our nurses counsel the employees about epinephrine autoinjectors, make sure that, or try to counsel them, hopefully they'll get them. We also counsel them on, if anything, to recognize the symptoms, but to present to the emergency room, present to occupational health if they have a significant problem. The other thing that we do is ask the employees to let their supervisors know that they have an issue like this, so that the supervisor could help them out.
And it sounds like you've really taken a proactive approach to identifying at-risk employees. Are there other measures that you can tell us about that you've implemented that increase all-employee awareness?
Well, we have a poster campaign in our common areas of our hospitals that flush out really what an employee should do if a fellow employee is having an anaphylactic reaction. And this is primarily in the cafeteria areas. And that would be to stabilize the individual, make sure that you maintain an airway. If the individual has an epinephrine autoinjector, to inject that, and our state allows that to occur. And probably the easiest thing, of course, is to triage that individual off to the emergency department or occupational health, so the employees know what to do in case of an emergency.
Just to be clear for our audience, state laws may vary on who can administer or assist in the administration of epinephrine autoinjectors, so be sure to check the law in your state. Ed, thinking about our audience and individuals maybe working in other organizations or companies and interested in getting a program started like the one that you've been instrumental in at Hopkins, are there some simple recommendations or direct ways to get started?
Well, I think that the organization has to realize that this is a significant problem, and that allergic individuals can actually die from this condition. So I think once you realize that, you can take measures. And again, the most important measures: identify the employees who are at risk, have a cadre of individuals who are trained in how to deal with this particular problem. If there's food served, query the employees, do they have food allergies? And I think those preventative measures at least can get you started.
Ed, you've obviously made some great strides at Hopkins. Thinking ahead and building in the concept of continuous quality improvement, what additional measures would you be looking at over the next few years, and how do you see those playing out?
I think I just want to build on what we're doing and probably get the message out even better amongst our employees about the importance of preventing anaphylaxis, about employees who have had a previous episode of anaphylaxis to have an epinephrine auto-injector. And I think that would probably improve our program more. Although, as I was saying, we have very, very few incidences of occupational asthma in our environment, and very few of our patients now have an anaphylactic reaction secondary to latex. So I think we've done pretty good.
Well, again, Ed, thank you for being here with us today. And again, welcome back to ACOEM. You know you're welcome anytime. I'm sure that many in our audience are going to find elements of your experience relevant in their own institutions and will help them move their own programs forward. So thank you again for being with us. And if you have any questions for Ron or Ed, be sure to email them to us at the address on this page, and we'll get back to you with an answer shortly. Coming up after a short break, our final guest from the program will talk about a worst-case scenario, an anaphylaxis reaction. Are you ready in an emergency? Don't miss it. We'll be right back. Welcome back to the program. I think now we have a pretty good sense of how serious anaphylaxis can be in the workplace. And we got a closer look at how one organization is taking thorough measures to avoid accidental exposures and reactions. But what about being prepared to respond in an emergency situation? An anaphylaxis event could be life-threatening. Joining me in our final segment is National Safety Council Director of Program Development and Training, Barbara Caracci. Barbara, thank you for joining us here at ACOEM.
My pleasure.
I understand you had some tough weather getting in last night, and we're glad you arrived here safely.
Thank you.
Could we start by just asking you to talk a little bit about the National Safety Council and some of the programs that you help manage?
Of course. As you know, the National Safety Council is a nonprofit, membership-based organization, and our headquarters are here in Illinois. And we focus on helping companies and our members to save lives and mitigate injuries in the workforce, as well as at home and in communities. And the way that we do that is through education, advocacy, a number of other ways. And it is our expectation that through the use of these programs and through advocacy, we will reduce the number of people who are killed or injured in these various venues. I specifically work in the first aid department of the National Safety Council, and we provide training for employers and community members in first aid and CPR. And we also help employers to set up emergency response teams and emergency response plans so that when an emergency occurs, they are better prepared to handle it.
Right. Barbara, with particular respect to allergic reactions, what are some of the most common causes in the workplace?
Oh, lots of causes, and you will see specific workplaces have a greater tendency towards some of these. For example, latex is a huge cause of anaphylactic reaction, and you see that, of course, in hospital settings. And you will also see food. In elementary schools, when you and I were children, our moms would bring cupcakes, and now that's just not allowed because so many children have the potential for anaphylactic reaction. And so food illness is caused by shellfish or peanuts, tree nuts is another cause. Certainly medicines, penicillin would be an example. And then of course bee stings, insect stings, and workplaces where workers are outdoors in telecommunications, for example, or construction, particularly vulnerable because of the presence of those insects and bees.
So are you then seeing an increase in allergic reactions?
We are.
And if so, why do you think that that's the case?
Well, I think across the board for all age groups we're seeing an increase in anaphylactic reactions. Of course, we're looking at it and identifying it more now in children, and I think we know to pay attention to it more, but we're seeing a lot of adults later on in life having severe allergic reactions to these items that I mentioned earlier.
So what are some of the signs and symptoms of an anaphylactic reaction?
Well, they're going to vary, and they could go anywhere from mild to severe. You may see a little blotchiness, or someone may say that they have a symptom of itchiness, but that can easily progress, and the reaction can be more severe, which would include, and this is where it gets life-threatening, a difficulty breathing, a wheezing, or a tightness in the chest or in the throat, which could make the person feel very anxious. So you will see anxiety, agitation sometimes. Other common symptoms would be a puffiness in the face, in the throat, in the eyes, almost a swelling. And in some extreme cases, a person could have varying degrees of responsiveness.
If you witness somebody having an anaphylactic reaction, what kinds of first aid measures should you take?
Well, what we teach our students in first aid classes, whether they take these classes as daycare providers or teachers or emergency response team members, is that the first thing they need to do is ask the person when they see these signs and symptoms if they have an epinephrine or an autoinjector. And if so, then they should go and get it so that the person can use it themselves. Some state laws will permit a rescuer to open the container with the epinephrine autoinjector and then administer it for the person. But the need for that epinephrine is immediate because, as I said, this is a life-threatening situation. So we teach people that they look for the signs and symptoms. They ask if the person has an epinephrine autoinjector, they retrieve it, and then they either assist the person in using it or they allow the person to use it if they're able. And then, of course, anaphylaxis is so life-threatening. The autoinjector has a small window of time that it works, and so we always teach people to call 911 as well.
When someone was administering an epinephrine autoinjector, what are the best steps to take?
Well, the method of using it is going to vary depending upon the kind of autoinjector that they have. It is always administered intramuscularly, and so the appearance of the epinephrine autoinjector will vary depending on the manufacturer, but the directions will always be on the label of the injector. And so it's best to read that label carefully. We teach people a universal method of administering it in the thigh without removing any clothes, and to keep the injector inserted for about 10 to 15 seconds, and then to pull it straight out and have the person who's having the reaction or the rescuer themselves rub the area because it will be a little bit sore.
Barbara, going back to companies again, are there particular industries or type of workers that you've seen that are particularly at risk?
Well, earlier I mentioned construction workers, telecommunications workers, people who work outdoors, landscapers, for example. They are going to see more than you and I would see bee stings or insect stings that could trigger this kind of a response. And so employers need to be very mindful of the fact that this is a risk in the environment. In school settings, we're becoming more aware of the food allergies, and so our teachers and our administrators, not just the school nurses, need to be aware of the signs and symptoms so that they can act in an emergency. They also need to be aware if the student is one who has an epinephrine autoinjector and it potentially has these allergies. Other industries, of course, hospitals, where medical exam gloves are common, would need to use alternative methods of personal protective equipment for their employees, because a person may not initially be allergic to latex, but over time, overuse could develop that sensitivity, that oversensitivity to the latex, which would cause an anaphylactic reaction.
So, Barbara, in your experience, you've seen a number of companies, I'm sure, that have emergency response plans in place. In your experience, how important is that?
It's very important. It is a life-threatening emergency when someone has a severe anaphylactic reaction. And as I mentioned, with the signs and symptoms, you're going to see a difficulty breathing and wheezing and tightness in the chest, and a person may become very, very anxious. And so we, as you know, if you stop breathing very shortly thereafter, the heart is going to stop beating, and now you have a situation where cardiopulmonary resuscitation is needed. And for that reason, we act immediately. We use the epinephrine autoinjector, and we call 911 because this is a very life-threatening emergency.
Well, thank you again, Barbara, for being here with us today and for sharing that critical information with us. There certainly are many steps a company can take to be ready to respond to an anaphylaxis emergency. The best medicine is always to avoid an allergen, but in the event of an unexpected anaphylactic reaction, being prepared could save a life. If you haven't done so already, please submit your questions and be sure to take advantage of the downloadable resources here on the webpage. If you joined us late or would like to view this program in its entirety again, an on-demand version will be available at the same URL shortly. On behalf of ACOEM and the National Safety Council, as well as today's guests, thanks for watching, and let's make anaphylaxis preparedness a priority in your workplace today.